Alright guys, so now we're going to move on to non-hazardous single draw. I have all of my supplies here. I also have my worksheet here of all my math, my supplies, and my calculations. So again, when you come into the lab and you pull these different exercises from the binder that we have, on the very top it's going to tell you what it is that you're going to be compounding. So for example, this one here says non-hazardous single draw. Here's the order. Here's a list of your supplies that you need. And then down here, that's where you put your total amount of calculation, okay? Now for validation, you will not be given a list of supplies. For validation, when you get to that point, you should tell me what kind of supplies you're gonna need and the amount of the supplies that you're going to need. The only thing that we check during validation is your math, okay? Also, I highly suggest that for validation, you make little notes for yourself, just like I did here. Make little notes for yourself to remember, okay? So for example, I said positive pressure, because a lot of students tend to forget when to use positive pressure and when to use negative pressure. Remember, all non-hazardous products we use positive pressure with, okay? So for this here, my calculation right here, I took my order, which is 200 milligrams, that's what the doctor ordered for this patient, and put that over my concentration. My concentration is always given to me. Remember, concentration always has two parts. It's going to have the strength and a volume, and it's always going to be right next to each other, okay? So don't be tempted to pull other numbers from other areas, because students do that. So if you always remember that a concentration has two components, the strength and the volume, you'll never be confused and you'll know exactly what to plug in where. So again, I have my order here, 200 milligrams over 25 milligrams per 1 ml. Cancel out my like terms and my calculation comes out to be 8 mLs. So let's get started. So before you start cleaning your supplies, remember we are to spray our gloves. Remember, you don't increase drying time, you just allow them to dry on their own. And the reason we do that is because we want to allow the 70% isopropyl alcohol to penetrate any type of bacteria cell wall that may be on our gloves. Okay, if we increase the drying time, then there's really not enough time for the alcohol to penetrate the cell wall of the bacteria. So it looks like my gloves are fairly dry. I'm going to go ahead and now grab my lint-free paper towel to start wiping our supplies down. We don't need to use a new paper towel for each supply that we wipe down. You can use the same paper towel to clean all of your supplies down. Okay? So I do want to go over a few important parts. Remember that this hood has 6 inches all around where we are allowed to put paper products. So basically you have 6 inches on the side here, 6 inches in the front, and 6 inches on the other side, okay? And again, you are allowed to have paper products in this hood within those 6 inches. So I'm going to start off by cleaning my IV bag. I'm going to set it in my 6 inches. I'm going to wipe down my syringe. Now you can go ahead and start setting up your supplies in your hood and your DCA, designated compounding area. You may hear us call this staging, and that's exactly what we're doing. We're staging our products here. Remember, you have quite a bit of room, so use it up. Sometimes I see students, they set up all their stuff right next to each other. But I have all this room here, so feel free to use it. Next is my syringe. Remember, since my air is coming from the back towards me, the operator, That means that I have to open up my syringe towards the airflow. When you initially take out your syringe, we're going to put it down with the tip facing the airflow. During lecture, you learned that the tip and then where the plunger is are the two most critical parts. However, when we first take the syringe out, the most critical part in this case would be the tip. So that's why we put it that way. The next thing is my needle. Again, I'm going to open it towards the airflow. I'll attach it. Notice that I'm attaching it and the air is still hitting that critical area. Don't attach it this way, but again this way. Now when I attach my needle, I'm going to place it horizontal. The next thing that I'm going to do is I'm going to take the top off of my vial. Notice how when I uncapped it, it was towards me. Again, I don't want to disrupt the airflow. I'm going to open up my alcohol pad, wipe the IV port. Remember, the white port is the only port that pharmacy uses. Second alcohol pad, I'm going to wipe my vial down towards me. Now from here, I personally like to clear all of my trash, throw it away, and then since I came out of the hood multiple times as I was cleaning my products, since I'm pretty much at the stage where I'm ready to compound, I'm going to spray my gloves again. I'm going to allow them to dry. Now before I actually start compounding, remember that my syringe has to have air in it. For non-hazardous, we always put 100% of air that we need. In this case, based on my calculations, I determined that I needed mLs of drug. Therefore, my syringe is going to have 8 mLs of air in it. Okay? So my gloves are pretty dry now. I'm ready to compound. So I'm going to pick up my syringe and I'm going to pull back to 8. So now it's at 8 mLs. And now I can go ahead and uncap my needle. So remember, if you're using this method to uncap your needle, your arms need to be straight. And because of muscle memory, it will not allow you to come back and accidentally stab yourself, because I know a lot of students are scared of doing that. This is my favorite way of uncapping the needle, so this is the one that I'll be using. So uncap it. The open part of the cap needs to be placed down, facing the airflow. I'm going to bring my vial towards me. Remember, we want to have the bevel up. When we have the bevel up, that's the sharpest point of that needle. The bevel is that little opening that you see. At a 45-degree angle, I'm going to go ahead and apply pressure where the rubber stopper is, and then I'm going to go straight in. At that point, we like to do what's called a peace sign, or a backwards peace sign, I should say. We grab it this way, and we flip the vial to the side so that we don't... Pause. Come over on